November is Lung Cancer Awareness Month, and today we're discussing important signs, prevention tips, and facts about lung health with the experts at Trinity Health. April McManes, she's a physician assistant with the Thoracic Surgery program at Trinity Health the Cancer Center, joining us this morning with some important info. Good morning, April.
Good morning.
Thanks for being here.
Thank you for having me.
Lung Cancer Awareness Month. Why is that so important? I'm curious, are the numbers getting worse, bad? Where are we when it comes to lung cancer in America?
So lung cancer is actually the second most common cancer in the United States, but is actually the most is a cancer that causes more cancer deaths than any of the other cancers. More people in America die from lung cancer than breast, colon, and prostate cancer combined, unfortunately.
My. Okay, well, you hear breast cancer, colon cancer, and you see survival stories. Lung cancer seems to be a little bit more, well, deadly. So when it comes to the signs of lung cancer, how would someone know? Is it simply being short of breath?
So unfortunately, most early lung cancers don't present with symptoms. That being said, anyone that has symptoms including chronic cough, persistent respiratory infections, shortness of breath, as you said, chest pain, weight loss, unusual fatigue, hoarseness, they should reach out to your primary care provider because those can be signs of early lung cancer.
So you could have lung cancer with no signs presenting. So it's something that is there anything that we can do to keep our lungs healthy? Is there a workout that you can do for your lungs?
So the most important thing is to avoid smoking, avoid vaping, exercising regularly is important. Getting regular health checkups, trying to minimize exposure to air pollutants. Something most people don't think about is having your home checked for radon. Radon exposure is actually the second cause of lung cancer, second most common cause of lung cancer behind cigarette smoking.
No kidding. So you hear cigarette, of course people know that. Stop smoking, right? This is the number, it's the headline. But that radon, didn't realize that was number two.
Yes.
You would think maybe all these other factors could do that. So getting a radon test in your home could be really important.
Absolutely.
What about getting, I'm sure, early detection? When it comes to cancer, early detection always seems to be the key. Since there are no symptoms, how does one get early detected?
So early detection is vital. We offer something called a low-dose CAT scan. That's part of our lung cancer screening. Low-dose CAT scans can detect early lung cancer before you have symptoms and when treatment is most effective. This improves patient outcomes and also increases survival rates.
Absolutely, because the sooner you catch it, the sooner you can treat it. How does someone get one of those screenings?
So you can qualify for the low-dose CAT scans if you're between the ages of 50 and 80 years old, if you are a current smoker or have a significant smoking history. Anyone that has questions about these qualifications, or if they want to set up an appointment, you should have a conversation with your primary care provider because they'll be the ones to set that up for you.
And we've got that information right there on the screen, right there, between ages of 50 and 80, current or previous smoker, and things like that. What about treating this? So if something happens, you've got the diagnosis. There's lung cancer here. How does it treat it?
So there have been major advancements in lung treatment over the years. We have surgical options, including robotic surgeries, radiation therapies. At the Cancer Center, we offer something called CyberKnife radiation. There are new chemotherapy options, including immunotherapies and targeted therapies. All these advancements provide patients with better treatment options than ever before.
And speak to the cancer community at Trinity Health, because this is really multifaceted.
Right. So we're part of a cancer network. We partner with the University of Michigan, actually, to provide a better range of cancer care, including advanced treatment options, clinical trials, and we use something called multidisciplinary care teams that can provide patients more options and better cancer care.
Absolutely, and you can get it all at one place. Trinity's got you covered, right? So all you have to do is check out trinityhealthmichigan.org. And of course, the Cancer Center, their entire team, the staff, making sure they can detect it early and treat it with the latest tech to get the best possible outcomes. 616-685-5600 for more information. Thank you for the time this morning, April.
Thank you.
You bet. We'll be right back.